Yeah.
Test mic 1, 2, 3. Hello, test mic 1, 2, 3. Okay. Okay. Okay, magandang hapon po sa inyo lahat. Good afternoon to all our media partners who are here with us in the Land Center of the Philippines and also to those media partners who are with us in the Zoom and our DOH platforms. Magandang hapon po sa inyo sa amin pong Media Forum, November 25, 2020. Kasama po natin sa hapon na ito ang ating officer in charge, Undersecretary Maria Rosario Singer Here. And we will go now directly to the questions that have been submitted yesterday. For the first question po, may I ask TV type, JT.
Hi ma'am. Ma'am, nakapasok na rin po ba sa Pilipinas yung pong Omicron subvariant BQ1.1 and BQ.1 which are said to be driving infections in the US? If ever we will get more information on these variants, are these more invasive? Thank you so much.
Thank you, JC, and good afternoon to all of you at our media partners at lahat ng sumusubaybay sa media forum ng Pagawaran ng Kalusugan. Unang-una, marami na po tayong variants na na-detect sa bansa, including the BQ.1 and BQ1.1. Ang kailangan natin laging tatandaan on this variant this is part of the cycle of the virus. The virus will continuously mutate because it is part of their life cycle. As long as there are hosts, which are humans, katulad natin, maraming hindi bakunado, mas nagkakaroon ng chance na mag-mutate ang ating mga virus. So, these sub-variants ng Omicron ay naandito na po. Finally, in our posted issuances of publication in our website, dun sa nilalagyan natin, every time na lumalabas po yung ating mga sequencing results, we post it in our website so that for everybody's information. Ang kailangan lang natin tandaan, with one of these sub-variants that are being published o na ma-detect natin through our sequencing results, pareho pa rin po ang ating proteksyon na kailangan dyan. It should always be our minimum public health standards. Pati na rin po ang pinaka-important, magpapapakuna tayo so that we get protection, especially against this variant.
Thank you so much, Yusek and JC. The question of JC Pernalar, Matt Delor, Net 25, and Lay Alves and Jimmy. May we ask, okay. The next question, Yusek, is for Philippine News Agency, and it's not up right now. The rest Montemayor. The question for is DOH studying the possibility of giving a third booster to the vulnerable population, which are the immunocompromised, elderly, even there's enough supply of booster doses?
Yes, unang-una gusto natin ipaalam, we'd like to inform everybody that studies on how we may be able to better protect our population is being done regularly by our experts and of course the Department of Health. In terms of giving the third boosters, meaning after the second, may first, second, tapos third boosters, ang tinitignan na po natin ngayon would be this incoming or this new generation of vaccines. If we can already provide this to our vulnerable populations, in health, immunocompromised, in our healthcare workers. Pero kailangan tanggalin natin sa isip natin na even though there are a lot of vaccines still there in our warehouses, the original ones, ay kailangan na natin magbigay kahit wala pang ebidensya. Our provision of vaccines and the guidelines that we provide for us to provide the vaccines are all evidence-based. We base it on science so that we can ensure the safety, effectiveness para sa ating population.
Thank you so much, Yusek. We would like to acknowledge all to the representatives of the Embassy of Japan to grace our regular DOH meeting for you. Good afternoon to all of you. Next question po will be coming from the Inquirer Philippines. May we call on Captain Vivian.
Oh. Ma'am, you mentioned po last week na yung DOH requested for another like 7 billion para kaya ng healthcare workers for the rest of this year. Nag-grant na po ba ito and nabigay na po ba ng PPM? And ano po yung specific period ng coverage nito? Thank you po.
Yes, thank you, Kat. No, so unang-una, yes, we have already officially communicated to PDM last November 8 the request for an additional 27 billion for us to provide the benefits of our healthcare workers starting from July to December of 2022. Aside from that, we have had several communications also to BBM in terms of requesting for other budget requirements to cover also the previous months of 2022 and also the arrears that we have from July to December of 2021. The Department of Budget and Management issued a response to us. I think this was on Tuesday, if I'm not mistaken. And in the letter, they have responded that they are still continuously trying to identify funds so that they can provide for our healthcare workers. And part of this source of fund that they are looking at would be additional revenues for the government. So sabi lang nila, as of now, we still need to wait for this identification of additional revenue so that we can fulfill our obligation to our healthcare.
Thank you so much, Yusek and Kat, for your question. And we will now move forward to the second round of media question. May I again ask JC Cosico from TV5.
Hi, ma'am. Ma'am, yesterday daw po, sinabi na of the research that Metro Manila positivity rates like 9.2%. On November 22 from last week, 7.4%. Where can we attribute such increase? And is this a result of ETH restriction? And should the public be alarmed?
Yes, thank you, JC. No, so a lot of media and also the public are asking us because of this pronouncement. First, we'd just like to inform everybody that as we have always explained, we should not just base our analysis of the situation with our positivity rate. The positivity rate is affected by a lot of factors, especially now that most of our citizens are using antigen test instead of the RT-PCR test. So if you try to look at our positivity rate, it is a play of numbers. You are measuring the number of tests done per day against the number, or you're measuring the number of positive results over the number of tests done per day. When in fact, we know that there are fewer tests that are being done per day because a lot of people are using antigen tests. Therefore, if you will have fewer of this total number of tests being done, definitely you'll get a much larger number. And again, let me just tell you that it is not just positivity rate that we use so that we can assess or determine the situation of COVID-19 in our country. COVID-19 is not, we can now say that the COVID-19 cases, though there are some form of increases in number, the increases are not significant at this point. What would be most important for all of us right now would be that we are assured that our healthcare system is okay. Our hospitals are all at low risk capacity or occupancy for our COVID cases. This is what is most important because we know that cases are expected to still be here. COVID-19 virus is not going away. Cases are expected and we will still have this number of cases even throughout the following months. What would be most important for all of us right now would be that that the severe and critical cases are at that minimum level, and that deaths are at that minimum level, and our hospitals occupancy are all manageable.
Thank you so much, Yusek, for the clarification. The question of JC is also the same with Matt Stillion. Next question will be coming from Manila Bulletin and Analu De Vera. And the question for Yusek is, can we have details on what types of equipment, supply yung i-donate po ng Japanese government? Do we have estimates kung magkano po ito at saan po kayang mga areas na didistribute ito po?
Thank you, Mans. No? So first, we have had a total of almost 3.2 billion donation coming from the Japanese government already. And this would be in the form of assistance through equipments such as portable X-rays. There would be MRI. We also will be receiving some of these items that we have used for our COVID-19 response. Katulad po ng ating mga vaccine refrigerators, meron din pong mga trucks and vans that where we can use for our logistic distribution. There would be ambulances for our local government units. They also have constructed and renovated some of our health centers. For example, in Caloocan City, they provided medical equipments in Leyte. This MRI, CT scan, also there are portable ultrasound apparatus. They also donated 10 units of hemodialysis units. We would also receive 5 units of negative pressure booths. And all of this will be distributed to those areas that would be needing it the most. Katulad po dito sa lung center, they will be receiving yung portable X-ray and some of these commodities or supplies that the Japanese government is providing. Kaya po tayo meron ditong ceremonial turnover later on. But in the whole, if you try to look at this, the Japanese government had been supporting us throughout this crisis or this difficult situation that we have right now. And we are very much appreciative of that. And aside from that, it is just not equipments and vehicles that we have provided. They're also assisting us in our programs for drug prevention and rehabilitation. They also are helping us in developing mechanisms for us to be able to have community-based rehab and the relapse prevention program of our drug rehab. So all of these are being provided and we will be having our turnover later for some of these.
Thank you so much, Yusek, and of course, thank you to the Japanese representative from the Japanese embassy who are with us right now. So please join us also in the ceremonial turnover later. We'll now move forward to the last 2 questions submitted, and this will come from JC Costa.
Hi, ma'am. Okay. Hindi po bang RITM is bubuwagin if ever daw po na naisabat as yung proposed CDC, or will it be absorbed, and ano po yung maging functions ng dalawa? And will there be an overlap, ma'am? Thank you.
Thank you, JC. Actually, we had been hearing of this issue since last week, and I just like to assure our personnel, all of the personnel in the Research Institute for Tropical Medicine, na hindi po natin bubuwagin ang RITM. Wala rin pong katotohanan that merong mga tao from RITM na hindi ma-absorb o mawawala ng trabaho. There is no truth to that. In fact, what we are going to do is to further strengthen Research Institute for Tropical Medicine because we are going to subsume the RITM into our clearance Center for Disease Control, which will have more funds, which will have more support, which will have more experts for us to be further guided into these different tasks that we have. Yun pong ating mga offices sa RITM will be subsumed into the different centers of the current proposal for the Center for Disease Control. Like for example, the National Reference Laboratories of RITM will be subsumed under the functions of the Center for Health Laboratories of the Center for Disease Control. The clinical research units, the hospital ancillary services, its research laboratory functions will be subsumed under the Center for Health Evidence. As also, the biological research and manufacturing functions shall be temporarily absorbed under the Center for Health Evidence. In fact, magkakaroon din, we will also have this strengthened and increased capacity, especially for operational planning, clinical research, and biologicals manufacturing. just for the information of everybody, RITM even wrote the Department of Health and the legislators. They had a position last November 12, wherein RITM specifically stated that they fully support the establishment of the CDC and that it is a national public health agency where RITM will be subsumed. So there is no truth to that. Again, we assure our personnel in RITM, nobody will lose their work. Everybody will get to be absorbed based on the capacity of each of our personnel in RITM.
Thank you so much, Yusek. Final question from the submitted yesterday, Jay.
Ma'am, President Marcos named Emmanuel Rufino Ledesma Jr. as the acting president and the CEO of PhilHealth. May we get your reaction on this, ma'am, and bilang attached agency po ng DOH ng PhilHealth, what were your instructions to him or at least expectations to him? Thank you po.
Thank you, JC. Unang-una, of course, we welcome the appointment of Mr. Emmanuel Rufino Ledesma Jr. as the acting president and CEO of the Philippine Health Insurance Corporation. We have yet to meet him actually. No, we have set our meeting for Monday so that I can speak with him alongside with the former acting PCEO, who is Attorney Eli Santos, and the rest of the officials of PhilHealth, so that I can better direct them, especially that they have the new PCEO who's going to assume his position already. Mr. Mandy Ledesma, he has been appointed as an official board member of PhilHealth through the office of the president, and he has occupied one of the expert panel board assignments. No? Kasi sa PhilHealth board, meron po tayong 3 expert panel, tapos meron tayong iba pang mga members from indirect contributory and all. So siya po ay magiging board member and also as part of that, will be the PCEO of the PhilHealth. So we will await, pero syempre ang direction natin ngayon sa PhilHealth, at that would be one of the guidance that we will give to Mr. Ledesma as PCEO of PhilHealth would be to continue on and to facilitate that we have these reforms in PhilHealth expedited. Unang-una na dyan, the expansion of our benefit packages, katulad ng ating comprehensive outpatient benefit packages, which we had been trying to expand, no? Since we started this function as OIC. Meron din tayo mga specific packages, katulad ng mental health package, at saka yung iba pang ating dati pang ginagawa. Kailangan din tignan natin yung payment system ng PhilHealth. We would like to shift our payment system into this DRG and global budget system para mas maging efficient. And the third, of course, in support to the President's directive, that there would be this third-party assessment so that we can better assess and determine kung ano pa yung weaknesses dun sa system so that we can further.
Thank you so much, Yusek. We will now move forward to the live questions from our media partners. May we ask GMA 7 Leal.
Good afternoon po, ma'am. If you have the details po, ilan na po yung na-detect na cases ng BQ.1 and BQ.1.1? And ano po, kailan po na-detect ako?
Yes, Lay, no? So I do not have the specific details of such. We have posted this alongside with the other variants that we regularly post every after the sequencing result has been issued. As to the date, hindi ko na rin matandaan, but please check our website.
What do we know so far po about the new variant?
Well, what we know so far from this BQ.1 and BQ.1.1 would be that it is more transmissible and also it is highly immune evasive compared to the other subvariants of Omicron. Pero what we have always reiterated to everybody, that it is high time for us, no, that our mindset be that yes, we are aware that there are these variants and sub-variants being detected in the country, but we should also be aware that whatever variants or sub-variants that may be detected, our protocols for us to get protection and also to protect our family are all the same. We practice our minimum public health standards and also we get ourselves vaccinated. we need to continuously remind our public. And also the reason why we are not so much dwelling on, informing and disseminating this kind of information, though for the spirit of in the spirit of transparency also, we post it in our website. But that should not be the focus of our citizens now. The focus should be how we get ourselves protected, and that is through vaccination and following our minimum public health standards.
Thank you so much, Tita, for the clarification. Will we ask Pat Devilla? Okay then. Okay. Last question will be coming from Vivian.
You said good afternoon. On the leptospirosis case example, we saw on the website that there was an increase in cases this year compared to the same period last year. Even the death due to leptospirosis increased, and the NCBI recently mentioned that there's overcapacity of patients currently there because of an influx of or an increase in leptospirosis cases that needing dialysis, etc. So my question is, how do we assist these patients na kailangan transfer? Because based on our interview, some are concerned about the cost, so maliit pa sila sa hospital, private hospitals, and tips on how to avoid leptospirosis.
Thank you, Vivian. I think that's a very important question because I guess it came from that point where NKTI announced that they are having overcapacity in their hospital, which is very true. And we have gone to the hospital, sat down and met with Dr. Liquete, alongside with our CHT director, Director Gloria Balboa, for us to be able to find a solution to this current issue. First, I'd like to explain to our people that the reports may be somehow biased. Biased in that sense where, because NKTI would be our apex hospital and our specialty hospital for kidney diseases, that's why people who have this kind of symptoms or illnesses tends to go there instead of going to other hospitals. So if you'd find in our other hospitals, we do not have this kind of overcapacity for this kind of cases, because as I've said, it's NKTI people would prefer to go. Second, when we discussed with ED Liquete, one of the issues really would be manpower. There are extra dialysis machines in the hospital. There are extra beds and extra chairs for dialysis. But what they were lacking were manpower to man this dialysis for additional dialysis. So what we did when we had this meeting in NPPI, we immediately called the Philippine National Police and the Armed Forces of the Philippines if we can be able to get immediate assistance. So they immediately committed and responded, and they have sent their healthcare workers cadre to NKTI so that we can open up the gym in NKTI, put there the extra dialysis machine, and those that will man this dialysis machine are our assistants coming from PNP and AFP. These are their nurses and their doctors. Aside from that, we also mobilized our networks of healthcare facilities for government. And for that, we were able to transfer some of the patients, like there in Jose N. Rodriguez Memorial Hospital, in Tala Hospital, also in East Avenue. We also mobilized them so that we can be able to get additional hands. Now, Batangas Medical Center, as far as Batangas Medical Center, and some of our hospitals within NCR have already committed that they will be deploying nurses so that they can manage the number of cases currently in NKTI. So these networks have been mobilized already. It's just like the accordion principle during the time that we were having increased cases of COVID-19. That every time that there are difficulties or overcapacity in a specific hospital, we mobilize this network so that we can be able to get the needed help from our other hospitals who are not that overloaded yet. On the increase. Well, ang leptospirosis expectedly, especially during the rainy season, it increases. It's just that right now it is a kind of more emphasized because there would be on top of the non-communicable diseases or those people who have these kidney ailments in NKPI, on top of that, naidagdag pa this leptospirosis cases who needs dialysis as well. That's why the picture would seem to be like we are really over that limit. But in fact, it is really the period where leptospirosis cases would increase because of the rainy days. I'm not saying it's not preventable. This is very preventable. So we always remind our people, nagpapaalala po tayo, tag-ulan po tayo, kapag po bumabaha, kung tayo man ay nalusong sa tubig na hindi naman po natin talaga may iwasan, pumunta po tayo sa pinakamalapit na health center. Meron po tayong prophylaxis na medicines na pwedeng ibigay sa inyo ng libre para hindi na po maglala kung sa kapag magkakaroon na ganito sa akin.
Thank you so much, Yusek and Lilian. Yusek, may pahabol questions lang po from JC, then afterwards, Kathy. JC, please.
Hi, ma'am. Ma'am, can we get more details lang doon sa appointment ni Yusek Tayag sa office siya? And nakapag-oath na ba siya? And ma'am, one last, si Dr. Delgado of the Parent Hospitals, he said yesterday na sana daw ma-extend until first quarter next year yung COVID state of calamity. Your thought on that? Thank you.
Una-una si Undersecretary Eric Tayag took his oath last week. Nag-oath na siya and then he assumed his position already. He was assigned to our field implementation coordination team and he is in charge of our Northern Luzon area. So this Northern Luzon would comprise of Cordillera Administrative Region, Regions 1, 2, and 3. And he is in charge of overseeing the operations of our hospitals, our treatment and rehab centers, and our regional offices, and of course, coordination with local government through our regional offices there. The second question would be
State of calamity.
the state of calamity. So, the state of calamity, the state of calamity has been extended by the Office of the President until the end of the year. Now, if there are two options for us, we are just waiting. One would be our first option, and this is really the direction. If the Center for Disease Control bill would be enacted into law before the end of the year, we do not need to extend the state of calamity anymore. Right now, the state of calamity is there simply because of these different considerations that we have. Because how we implement our emergency use authority, how we have our vaccination program for COVID-19, how we regulate the prices of commodities and medicines during this time of the pandemic are all aligned and nakalinked doon sa ating state of calamity. Now, if the Center for Disease Control bill will be enacted, all of these provisions and considerations were already included into the Center for Disease Control bill. So if that gets to be enacted before the end of the year, we do not need to extend the state of calamity because we see right now that our local governments already can manage, national government also can already manage. So therefore, what we only need for this kind of declaration from the President would be the considerations that we're saying. Now, if this bill will not be enacted by the end of the year, that's the time that we need to consider if we will request from the Office of the President another extension, even just for 1 or 2 months, because we still need to continue on with the response for COVID-19.
Thank you so much, Yusek. Last question from Kathy Villiam.
Follow up po dun sa appointment ni Sir Emmanuel Ledesma. Yung background niya po kasi is energy sector having served as CEO of PFA Academy. Ano po yung reaction niyo to this? Do you think po he's qualified for the position?
First, it would always be the prerogative of the President who he appoints. Based on the qualifications, tinignan naman natin yan yung credentials. Somehow he has that that qualifications and experience on management and governance. So in PhilHealth naman, it's just like any other agencies, although of course you need to have the technical know-how, especially on financing, on actuary, on insurance systems. But part of the work will always be managerial because you are going to oversee and guide the entire organization on the delivering the objectives for your mandate. So I guess we will be just guiding and working together with Mr. Ladesma with this position that he has been given. And there are a lot of excellent officials in PhilHealth also who can very well support him. And of course, the board of PhilHealth is there, wherein the chair is the Secretary of Health. So I think we can be able to push forth our reforms by just working together.
Thank you so much, Yusek. Final question from Gladys. I think she's asking for comments. Yusek.
Good afternoon. Gusto lang po sana namin alamin kung ano po yung komento na magpapadala po ng medical personnel ang AFP and CNP sa NKTI po. Thank you, ma'am.
Yes, syempre kami ay lubos na nagpapasalamat. We really appreciate the very timely and immediate response of our Philippine National Police, the Armed Forces of the Philippines, to this request for help coming from the Department of Health and of course our hospital, the National Kidney and Transplant Institute. Sana po this kind of working together and sharing resources would continue and be sustained because we are showing people that we are working not just as single agencies, but as whole of government to better provide good services to our Filipinos.
Thank you so much. And these are all the questions we can accommodate for today's media forum. Yusek, your final remarks, reminders.
Yes, I would like to thank everybody for joining us in this media forum for today, especially our media partners who have been our constant partners in disseminating correct information to our public. First, we just like to remind everybody that mutations of the virus is expected. It is part of their life cycle. As long as there are hosts that this virus can grow into or can live, this cycle of the virus of mutation will always happen. Cases are expected because the virus is still here and will remain to be here. But what would be most important would be no matter what type or irrespective of the type of variants of subvariants that we can detect in our country, as long as that our public, all of us knows how to protect ourselves through vaccines and through the compliance to minimum public health standards, and then we can assure ourselves and the whole community that we are protected. The second would be that we would just like to remind everybody, and we are going to have our meeting with the IATF soon, that our alert level system is still in place, it is still being implemented, but there will be changes and we are going to propose in the next IATF meeting that the alert level system be used as part or be used just like the storm signal of Pag-asa, wherein we are already going to decouple the restrictions from the signals or the alert levels that we have within and among the local government. So now it is really going to be that each and every Filipino should know what type of risk you have and what type of or what are the protocols that would be fit for you that you get your protection against this COVID-19. And the third, of course, the science continue to evolve, but there are proven strategies against COVID-19 tulad ng lagi natin sinasabi, pagsusuot ng mask kung kailangan natin, ang ating pagbabakuna, palagi ang paghugas ng kamay, sa masyadong matataong lugar, and ventilation should always be adequate pag tayo ay pupunta doon. Let us all continue to work together. We should all live or learn to live that virus will be here, but if only we all know how to protect ourselves at tayo po ay makakaagapay and we can reach that to normal. So with that, gusto din po namin magpaalala para po sa mga iba pang sakit na atin pong nararanasan ngayon sa ating bansa, especially the non-communicable diseases. Tayo po ay palagyan, lalo na magpapasko, piliin natin yung ating mga pinakain, huwag masyadong matataba, yung masyadong malalangis, huwag masyadong matatamis, iwasan yung mga bisyo, at sana po tayo po ay laging aware on how we can be able to live healthily para naman po tayo ay mas protektado not just from COVID-19 but from other diseases. So yun lamang po at gusto natin magpasalamat and we will see all of you next.
Thank you so much for media partners for joining the media forum.